Okay.
Full-time and part-time basis. Yeah.
Okay. All right. So let's run it again. Make it smooth for me. What are your top 5 most severe impairments?
Chronic fatigue syndrome,
Mm-hmm.
anxiety, panic attacks, and depression.
Okay. Which is the most severe impairment?
Chronic fatigue syndrome.
Can you tell me with that chronic fatigue syndrome, when was it starting? When did it become severe? And where is it at now? And remember, I want good examples, one sentence.
It started in 2018 when I was working at Delta Airlines. The travel agent, I got sick working around computers. I'd had flu-like symptoms and fevers, and I'd be bedridden for several days. Very limited activity outside of the house. And presently, I'm housebound and not able to leave the house very often. Essentially spend most of the day either in bed or sitting in the backyard in the garden.
Okay. What is your second most severe impairment?
My second most severe impairment is anxiety.
Okay. And what happened with the anxiety when it started? When did it become severe? And where is it at now?
My anxiety started in September 11. I think it was 2001 when 9/11 hit, and I was in Africa at the time, and I already had a fear of flying, and I started having panic attacks around that time, and I've had anxiety since I was a teenager, and it got exacerbated after I got chronic fatigue syndrome, knowing that coping with the loss of physical functioning created a lot of worry about my future finances.
Okay. I understand that, and that's fine. What I'm not hearing in any of your story, and I think this is incredibly important, is essentially where's the medical evidence? Like, you're not talking about any of the medical facilities, not bringing up any objective evidence that proves what, there was a surgery. Did they do a medical therapy based review? Did they do a test on you? What defines, in your opinion, objective evidence from the medical provider that showed that it was severe? Because remember, with the beginning of this, there's not going to be medical evidence. Like, where did your impairment begin? With that whole gig, when you begin the whole process of this, you got to keep in mind at the very beginning, there's no objective evidence. Then you get severe, there's objective evidence, and where you're at now is, your explanation of what's going on. So the very beginning of this needs to be, hey, I noticed it because of this. And then the severe part needs to have some reference to medical. So, were you Baker acted? Did something happen? Like, what happened for you to know exactly when it became severe?
Well, I was bedridden for the last 3 years, and for several days out of the month, and it could be triggered by washing the dishes. And I wasn't diagnosed till Stanford diagnosed it in October, and essentially they diagnosed it based on a CDC questionnaire, and I was recently given a cardiopulmonary test, and I was told that that I have marked impairments in oxygen consumption, and essentially it's worse than congestive heart failure patients. It's a 2-day test, and they can repeat it. Severe congestive heart failure patients can repeat it day 1 and day 2, and people with chronic fatigue syndrome can't meet their day 1 workload on day 2, and so that 2-day sleep that I got done last month is the most recent objective medical evidence.
Okay. Now, you don't want to reference medical evidence that was done a month ago, because the problem is, you're basically killing your claim up to that point to say that's when it became severe. So you're going to have to find something that's more back in time that you can prove, that you can show is the reason essentially that you became severely disabled with the anxiety. All right, so talk to me, what's your third most severe impairment?
My third most severe impairment is depression. And that was exacerbated from the physical losses that I got from having chronic fatigue syndrome and the grief cycles of dealing with physical loss that I experience just about every day.
I don't feel like I'm connecting to your testimony. You know, I'm sitting here and I'm bored. I'm almost like I'm just kind of like falling asleep to the testimony. Nothing about it wakes me up. It's a monotone based voice. Is your hearing in the morning or is it later in the day?
It's in midday.
Midday, is it before lunch or after lunch?
It's at 12:15.
Okay. That means probably before lunch. No, because if it's 12:15, he's taking lunch at either 1 or he's taking it at 11. Do you know how many hearings that judge is doing for the day?
I'm not sure, but it's 12:15 California time, and then I believe in Missouri that would be 10:15 a.m.
Okay, so that's going to be a morning one. All right, so you got a better shot then, because if it's in the morning, the judge is going to be paying more attention to what's going on. Directly before lunch and way later in the day, around like 3 o'clock, you can't have kind of like that slow, meandering approach to the answer. You have to have a more direct approach. Otherwise, the judge is going to fall asleep and kind of not be paying attention. All right, so let's run through this again. And these are the timelines that you're going to basically experience while you're going through this whole thing. And I want you to understand that a lot of people, when they go and do impaired for what their impairments are, then they're not impaired to define their impairments, and they're not ready to go ahead and talk about their impairments for at-home activities and at-work activities. The best claimants that I know, when they took it all the way, when we went all the way through the questions, got them really, really strong, when they were able to give like that 100%, they were good at timelines. And a big thing that I think I can feel you're a little worried about is that it sounds like your medical evidence is not consistent for severity for the past couple of years. But it sounds like there's some more recent medical documentation that shows severity. Is that correct?
Yeah, yes. The first 2/3 from 2018 to now is weak, and the last year, 1 year, from mid 2020 to now, is the strongest point of the case.
Mm-hmm. Okay. Mid 2020. All right. Now, are you prepared? Now, has the attorney that you're currently working with talked with you about the amended alleged onset date, where the onset date should be when your strongest evidence to provide that you were severely impaired is?
I did bring up a couple days ago to move up if he can consider moving up the onset date to possibly 2020, because I was in Mexico for 6 months in late 2019, and there was a little bit of gap, into 6-month gap in treatment there, and he said he'll look into it, and I'm not sure what's going to happen, but all I could do is ask.
Okay. So, all right, one thing you want to get a hold of too is a copy of the brief that the attorney is going to be using as per the opening statement / the actual hearing. All right, so I want you to get a pen and a piece of paper. Do you have one with you?
On my phone, I do have a note application, notepad.
Sure. Okay, perfect. All right, so what I'd ask you to go ahead and look into is basically the following. I want you to write down, these are the timelines that you need to work on. So when you're ready, okay, I'll go ahead and give them to you.
Okay, go for it.
All right, the first timeline I need you to be good at are the impairments. That's what we were just working on. Okay. The next timeline that I need you to work on would be the medications. The medications are basically when you started taking medications, when you started getting side effects from them, what impairments they were used for, etc.
Yes.
Okay. The next one I want you to go ahead and work on is the timeline of surgeries, when you had those surgeries or when you had those specific mental therapies that were relevant to your claim. Okay. The next one you're going to be working on are timelines as to imaging that was done. Timelines that as to imaging that was done. Now, your claim is mostly a mental claim, which means that there's not going to be a lot of imaging, but just be aware if there was any, you want to go ahead and utilize that.
Okay.
Perfect. Now, the next one is the final one, which is lifestyle. Lifestyle, the timeline of life. Well, it's actually two more. Lifestyle. When did your lifestyle change? When did you stop using your hobbies? When did you go ahead and stop being able to cook, clean, do laundry, etc.? Go shopping. When did you stop your ability to go ahead and do those different functions? Knowing the timeline of those is incredibly important because the judge is going to be mostly asking questions about your at-home lifestyle when you're in that disability hearing, sitting in that hot seat.
Yes.
Mm-hmm. Okay. And then the final one is vocational track. Past 15 years, where did you work? Why can't you work each one of those jobs nowadays? So that's incredibly important, going through each job that you had where you earned at least a couple of grand at that job or more, and being able to talk about and specify why in each one of those jobs you would no longer be able to work that job. Okay. Now we're going to run a quick series of questions, and we're going to take the next call. Good sir, we're going to do the impairments one like we were doing before. Go ahead and rock this one. Good sir, what are your top 5 most severe impairments?
My top 5 most severe impairments is chronic fatigue syndrome with a cognitive disorder, anxiety, panic attacks, and depression.
Excellent. Can you tell me, out of all of those, which is the most severe?
Chronic fatigue syndrome with cognitive impairment.
Can you give me a timeline as to when that impairment started, when it became severe, and where you're at with it now?
It started in 2018 while I was working as a travel agent at Delta.
Mm-hmm.
It became severe a few months later after I attempted to go back to full-time work and was not able to do it. And I was also not able to, that's when I started losing keys, credit cards, forgetting things, and my dad yelled at me. And later on, where I am now, is essentially in the same boat.
Okay. So, okay, all right, that's good. That's okay, I understand that. Now, imagine we're going through number 2, number 3, number 4, number 5 of all of the impairments that you stated, right? So your top 5 just impairments. That's number 1. Imagine we just went through 2, 3, 4, and 5. Now we're going on to the next one for the timelines. This one you're new to. Good sir, walk me through what medications are you currently taking, and when did you start those medications, and are they effective?
The medications I'm taking is low-dose naltrexone, 0.5 milligram. I've been taking it for about 6 months. The doctor told me give it up to a year for it to start kicking in. I haven't noticed any benefits, side effects at a higher dose. I get heart palpitations from it. Other medication is Klonopin, a benzodiazepine that I take for anxiety.
Mm-hmm.
It's kept me from being anxious, it's kept me from like burning the house down and going to the ER. But I still have 2 to 3 panic attacks throughout the week. And the other medication is that I take is Remron for sleep, depression and sleep. And I still have unrefreshed sleep from that medication, and it makes me drowsy throughout the day.
That was all over the place. I didn't like that at all. We're going to skip it, though. We're going to keep rolling because medications are new too. Surgeries. What surgeries have you had and or medical treatment that was objective evidence from the mental field, because your claim's mostly mental? Walk me through what surgeries or mental review objective evidence has been provided over the past couple of years for your impairments.
December 2020, thorough psychological CE with lots of cognitive and memory testing and subset memory testing, and for cognitive brain portion of my impairments. As far as physical portion of my impairments, Stanford, the CDC Diagnostic criteria of fatigue, brain fog, unrefreshed sleep, and muscle aches and pains, and recent objective evidence
Okay.
is the 2-day abnormal cardiopulmonary exercise testing.
Okay, understood. Walk me through when it comes to imaging. Have you had any imaging done which shows your impairments or anything related to imaging that would help with your mental impairments?
I've had MRIs done. They've come back normal. And other than that, I haven't had any other imaging done.
Okay. All right, let's talk about this. Lifestyle. Do you have any difficulty with cooking, cleaning, laundry, maybe going shopping? And walk me through, when did these become difficult for you?
Yeah, cooking became a challenge. 2 years ago, around 2019, I started kitchen in general, leaving kitchen cabinets and open and burning pots and pans. And what recipes are. I'm not even allowed to cook anymore because of that. My mom usually cooks the meals. Sometimes I will microwave food. Cleaning, I can't get around furniture to move it. When I do clean, I clean a portion. On a good day, I'll clean a portion of my room. As far as money, I don't have a lot of bills. But if I did, I usually forget and end up sometimes overdrafting.
Okay. All right, talk to me about the jobs that you had within the past 15 years. Why would you have a tough time doing those jobs nowadays?
Yes, the jobs that I've had within the last 15 years, I worked as a direct support professional with individuals with disabilities and coaching individuals, improving quality of life, and implementing independent living skill curriculums and teaching them how to minimize health, safety, and other risks.
Mm-hmm.
I would basically not be able to do that anymore because of my cognitive difficulty. If I was driven to work, within probably 10 to 20 minutes, I'd start getting brain fogged and not knowing what I was doing and start making errors. And if I did it continuously for a few days with my cardiopulmonary exercise testing, with the demands of the sedentary work for my testing, I would unpredictably crash for three to 5 days and be unreliable.
Okay, you got to work on that. But all right, so we've gone through these basic questions for the timelines.
Yes.
You have to start thinking in a linear fashion as to when all these impairments started, how they limit your ability to do the prior work you did, why you're not able to do the household functions you were once able to do, and what objective evidence you have, because the judge is sitting there thinking in this fashion. And I know that most people don't have a lot of connection to this timeline effect where they're trying to figure out, okay, cool, this is where my impairment started. This is where we ended up. I'm sitting in the chair right now in front of the judge, yada, yada, yada. People don't think that way when they're going to go and do their disability hearing. The way they think is like, here's my impairment. I'm so bad, judge, just find me disabled. That's not how it works. The way it works is the judge is looking at you and thinking, okay, what's the timeline arc here? When did they start having the problems? When did they become severe? If they became severe, and where are they at right now? What objective evidence is in the record medically that proves that they became disabled in that fashion or form, around such and such date? It's that timeline. And the timeline is incredibly important because it shows you the beginning of the claim and the end of the claim as to where you're at right now. And here's why that's important. When you're convincing the judge, you want to convince the judge of where you started, but more so when you became objectively, medically, severely disabled. And here's why. That severe disability mark represents when the judge can move your alleged onset date. Because if they can choose that alleged onset date, then what changes at that point is that essentially you'll be able to go forward and, show through, essentially your medical evidence that you're not able to function with your home activities or your work activities like you used to be able to. And the point of this whole thing is that the judge has to be able to prove in that brief to his bosses, right, the appeals council judges, he has to, and the chief judge of the ALJs, he has to be able to prove that he chose a proper point in time as to when ... you as an individual became objectively medically disabled. But if you can't help the judge out with that timeline, then you make it significantly harder for that judge to figure out exactly where it started, where it got really bad, and where you're at right now. Okay, good, sir. Do you have any questions for me before I pop over to the next caller?
Yes, Mr. Knott, if the objective evidence most recent is with the 6 months for the physical and the mental CE consultative objective testing, besides essentially, if I have the exhibit on me and all my old progress notes and my own personal testimony, is that really all I can go off of as far as objective evidence past 6 months ago? Or
Well, I mean, you obviously want to. It sounds like you have a bunch of recent medical evidence. That's the good stuff. Is that correct?
yes.
Okay, so in that case, you have to be careful with the whole 12-month rule, which is, you've been severely impaired. The impairment has lasted 12 months. It's severely impaired, yada, yada. You have to be careful of your elements there. But the bottom line is you're almost certainly going to have to amend your alleged onset date to when you have objective medical evidence that shows that you're severely impaired. Because right now it sounds like you didn't have a lot of good evidence, and then boom, 6 months ago you started getting it. Is that correct?
That's correct. When I was diagnosed in October, in October with CFS, I was told when you have CFS, it's a condition it has lasted for 6 months. So that would be 6 months prior to October to now. It's been close to a year from the doctor diagnosis from the infectious disease clinic, but hard like data than as far as the psych testing and the bicycling cardiopulmonary that came like within the last 4 to December to now.
Mm-hmm. Okay. You know what you need to do. And we've talked many times before. Now, let me ask you this. Even though we've talked many times before, was this testimony timeline system helpful for you, or was it overwhelming?
It was tough.
Okay. That's good. And the way I look at this, just so you know, when it comes to teaching people testimony, the most basic thing to do is have them go through the questions and see the answers. Even if they're not their answers, see the answers. That gets them accustomed to what they're going to be asked. The next thing I like to do after that is basically start to run the questions directly with them and get their answers. Then I like to speed it up and expect them to speed up with me. Then I like to throw in trick questions. But I think the next evolving point has to be basically, are they capable of explaining their timeline? And, I get claimants from all walks of life. Some of them want to be super involved. They want to call me every single day. And some of them, they don't want to know. They don't care. Let me know when I'm found disabled. That's it. They don't know what's going on with them. They don't care. It just is what it is. So what I think is important is that for those individuals who really want to take their disability game to the next level, to be able to go and be found disabled by helping the judge at the highest level that they can, these timelines, knowing your impairments, the medications, the surgeries, the imaging, the lifestyles, the past 15 years of work, being able to give a timeline accurately, consistently, is really going to help the judge out, because that's exactly the way their brain works. When did it start? When did it become severe? That's all they want to know,
I see what you're saying. Okay, within the best of my ability to write the timeline and the bullet points, and if there's memory problems, cognitive disorders, if that's shown in the hearing, don't use that as an excuse to try and as far as the bullet point and the timelines of the severity of impairments.
Right. Okay, good. All right, so, and sorry, the thing cut out there for a moment there. What was the very end of the question?
As far as the timeline and the bullet points of the severity of the impairments from 2018 and now, if I have mild cognitive impairment with a severe neurocognitive memory impairments, don't use that as an excuse not to write stuff down. Would not knowing it perfectly or exactly, or like maybe 30 to 40%, would that show a judge that the memory impairments that I have with knowing the timeline, or
Now, wait, run that question by me again, but just try to do it streamlined because I got lost there. Go ahead.
yeah. Essentially, if I have if I'm looking at timelines and bullet points, and I'm trying to memorize it, and if I have memory problems, and cognitive impairments, which obviously, ideally, you still want to be able to present it to the judge, and at the same time, I shouldn't see the impairments as an excuse to sort of say, hey, I'm going to struggle to remember this anyways, and let the judge see that. You know what I mean?
I got you. So here's the basic structure of it. You have to be to the point, and I know it's particularly difficult for you because of the cognitive disorder. You got to be at the point where you can get the judge the information they need, and you've already read your medical records, so you kind of know specifically where the good stuff is and where it's not. So when you endeavor into, this medical evidence, it's always wise to look at the way I look at medical evidence is it's a point system of like on a timeline. And, if I find something that's a good point, I just put it on the timeline. And if you make a list of 30, 40, maybe 50 bullet points, you can take those and keep skimming it down until you get to those that are really, really, really helpful for the claim. You really should only need about 15 bullet points going into a hearing to be able to explain and win your claim, which is why you want to go ahead and get a copy of your attorney's brief that they're going to be using. But anything you can do to boil it down to those basic bullet points and show those different impairments, obviously frontlining with your cognitive, that's pretty much where you want to go with this thing.
15 bullet points is what I'm looking at.
All right.
Okay.
Perfect, good sir. You have a wonderful night. I will catch you a little bit later, and we'll go from there.
Well, thank you, Mr. I appreciate the great work that you do.
Thank you, good sir. Have a wonderful night.
Thank you.
Bye-bye.
Bye.
Okay, guys, excellent. So let's see what's going on here. Okay, good. Okay, so we went through one phone call, and we got another one. All right, let's see what we got here. Let me see. Hold on. Hi, this is Attorney Walter Knott. We are live on YouTube. Remember to use a fake name. You can go ahead and run hearing questions with me, or I can go ahead and basically go ahead and answer a specific question that you may have. How can I help you?
Hi.
Howdy.
I had sent you an email about earlier this week, and you told me to reference it when I called in. I'm the one that my son passed away.
Oh, gotcha. Help me out with just a little bit of the email. What was the very beginning of the email?
I talked about how my son had died in 2016 or 2017, and I have a master's degree. Does that ring a bell?
Okay, so I found, yes, it was sent on May 16th, 2021, around 4:47 p.m.
Yeah, that sounds right.
Okay, cool. Let me read this real quick.
And I don't think there's anything sensitive in there if you want to read it for the other.
Okay, yeah, because that would be best. That way. Yeah. Okay, so guys, I'm going to read to you real quick this email. I'm going to make sure as I go through, I try to cut out anything that could be potentially classified. All right, here we go. I don't want to disclose that, obviously. Here's the email. I have a question about my situation. My son died in an accident several years ago. The accident was the result of neglect on my part. Due to only having a Class C misdemeanor from the city for a lawn mowing infraction, I had no real criminal history. The state determined that I was not a future risk, and thus I was not forced to give up my parental rights. The county or state has not prosecuted. I had depression, bipolar anxiety before my son's death. Since his death, I've been diagnosed with PTSD in addition. I've long struggled with employment. I have been fired from 32 of the 37 jobs I've had in my lifetime. I struggle with interpersonal relationships, and I am not well liked. We had another child 2 years ago. She had been out of my care for maybe 10 hours in her life, which were for my weekly counseling appointments. The therapist said that I should not bring her as I was not as open when she was there. Leaving her causes severe anxiety and feelings of impending doom. Medications have partially helped with my suicidal ideations, but my depression and anxiety remain largely out of control. I switch medications every few months in an attempt to find something that works. The treating nurse practitioner has suggested electroconvulsive therapy as a possible treatment. We also have children that are 7 and 9. They are a big help when they are here. I have physical limitations as well. Their mother takes them to school and picks them up. She usually prepares an after-school snack as well. I do it maybe 30% of the time. They are also able to make their own snacks as well. I cook a simple meal for dinner 50% of the time. I have a Master of Science and was a PhD student, but was overcome by my anxiety and depression and was forced out. It took me 4 years to get my MS. It took me 6 years to get my BA. I have bowel and urinary incontinence, arthritis in my knee, hip, and back. I have an impinged nerve in my back that leads to my legs. I can sit for 20 to 60 minutes before my legs fall asleep, or I have burning sensations running down my legs. I can walk maybe 100 feet before taking a break for 1 to 2 minutes. I avoid stairs as they cause me pain. The last time I went down my stairs in my house, I fell down the last 4 rungs. The SSA sent me for a psychological assessment. The psychiatrist, and I'm not making this up, was my therapist boss at his other job. The psychiatrist said that my symptoms were not severe enough to limit most of my life. I found this interesting because we didn't talk about this. The doctor for the physical exam noted some issues and suggested I was at least impaired on some level. Case was denied. Social Security said that I could do jobs with little interaction with my coworkers, the public, or my boss. I am planning on filing an appeal. You mentioned that ALJ will use taking care of kids against you. Any suggestions and possible video? Okay, so, all right. There's a lot in this. So let's kind of go through the basics with this whole thing. That way, I'm just going to summarize the paragraphs real quick. That way, the people that were listening have kind of like a bullet point list to go with. So first paragraph, son passed away, which resulted in PTSD. It was due to neglect on your part, but criminally, you were not charged with anything and you were allowed to keep parental rights. You do have other issues with depression, bipolar anxiety. You've been fired a lot, 32 of 37 jobs. You had another child recently that's 2 years ago, 2-year-old child. You're constantly bringing her places, probably out of fear of her being injured or lost and things like that. You've got a 7 and 9-year-old that help you out around the house. You have urinary and bowel incontinence. You do have a Master of Science, but you don't have a PhD because you couldn't finish it due to the impairments. Psychological CE assessment from the ME, medical expert on behalf of the SSA, basically said that you weren't impaired enough. Physical doctor said the same. Is that correct?
That would be an accurate summary.
Okay, perfect. So let's go through this real quick and kind of outline some of the basics that I'm seeing here as a particular issue. All right, so first and foremost, when it comes to the PTSD, that was obviously a direct result of the child situation. How does it manifest itself nowadays?
I have flashbacks to what happened, and I get queasy and sick to my stomach, and just kind of have to stop and reset for a couple of minutes to kind of get back into whatever is happening, as I'm in that moment. It's not related to the flashback. Yeah, it's just, I probably have somewhere between 3 and 5 a day. Sometimes more, sometimes less, but I'd say that's 4 is probably an average. Yeah, it just anytime that my daughter, if she were to leave the room for a second and I realize that I can't hear her or something, it causes my heart to go racing, and I end up going, looking for her in a very scared fashion. So,
okay. Let me ask you this. So,
I guess that's more anxiety, but yeah.
Gotcha. Okay, let me ask you this. So, and I know that you're having flashbacks, you're probably having nightmares. Are you writing them down and creating a diary of when you have them and what they are of?
I had started several months ago, and at the suggestion of my therapist, but I haven't been keeping with it.
Why not?
Honestly, it seems like a lot to do. That sounds ridiculous, I know, but the part of the problem is I have very low energy to do anything. The only thing I'm really able to do is just watch her, my youngest daughter, and make sure that she stays safe. But I know that, and it sounds ridiculous, but everything seems impossible. So
Let me ask you this. Do you mind if and remember too, this is a safe setting. Nobody's judging you. This is a learning setting where everybody gets to go ahead and learn how to basically do a better job on their claim. So I want you to understand, if at any point you don't feel comfortable, you can always hang up the phone. If at any point you don't feel like telling me more, you can always tell me. I would like to know more about what happened with the incident that caused the PTSD.
We had just had dinner, and my significant other asked me to put him in the bathtub.
Mm-hmm.
And I put him in the bathtub, and I went to go get my phone, and I got distracted while doing that. I was gone for probably 3 minutes, and during that 3 minutes, that was enough that he drowned and was not able to be resuscitated.
Okay. Now, are the flashbacks and nightmares specifically of that, or are they of something else?
Sometimes of that, like last night, I had a nightmare that my children, I'm sorry, the 2-year-olds.
Yeah, that's fine.
Olive, hey, I need some help, okay? Last night, I had a nightmare that the authorities were coming to take the kids away. So they revolve around those sort of topics. I would say that it's probably 50-50 between the actual incident and, well, that wouldn't be a flashback, but having a nightmare about them being removed from the house. So.
Okay. And help me out with this. Would it be a proper assumption that pretty much most of these flashbacks and nightmares are about either the loss of the child or the loss of other things in your life?
Just about the children.
Okay. And so when it comes to you protecting the 2-year-old, what are things that you do to make sure that the 2-year-old is safe?
She literally, I stay with her 24/7. Unless she happens to sneak out of the room. If she leaves the room, I leave the room. I'm hyper vigilant, and just really, it's not just me too. Her mom is the same way. If she sneaks out of the room and all of a sudden it's quiet, like she goes into like a panic attack. So it's just that constant vigilance of making sure that nothing's going on, and it's everything. Things that you wouldn't think would be a big deal all of a sudden really worry you. Like they have a pen because they choke on the top of the pen if it comes off, or it becomes all consuming. But sorry, these conversations are not hard in the sense I'm used to talking about it from therapy, but it is kind of hard to be in the hot seat.
No, you're fine. You're doing great. And keep in mind too, I'm going to be asking questions going forward that your therapist won't be going into because it's a different kind of line of logic. But next question I have, when it comes to things that you're doing to treat yourself, to get yourself to pull away from those nightmares, pull away from those, flashbacks, what are you doing?
I go to a weekly therapy session that's still weekly after 3 years.
Mm-hmm.
I always have the hope that some of the medications are going to kind of alleviate some of the anxiety and flashbacks, but they don't. They might have a slight effect on my anxiety, but it's not that great. I did have, at one point, I was on benzodiazepines, but they took me off because I'm also on narcotics for pain.
Mm-hmm.
The doctor was worried about overdoses from that. So,
okay. Okay. How have they been
that's
working?
what the class is called. If I'm incorrect on the anxiety drugs, I apologize. But
No, you're fine. How are they working? Are they working well?
no. Like I said, every few months they up the dose or switch the medication, and trying to find a cocktail that works for me. And the depression is long-standing. I mean, I've had ideations going back to when I was probably 10 or 11 years old.
Mm-hmm.
And over most of that time, I was treated in college, but that was, I went untreated for most of that time. So.
Okay. Help me out with this in understanding what's going on. And what I'm going to do is I'm actually going to quote some of the things that are going on with the statute related to, your particular impairment for the PTSD. I'm going to go ahead just so you guys are aware. It's 12.15. So if you Google 12.15 SSA disability, we're in the trauma and stressor-related disorders. Here are some of the things that basically they look for to define whether or not the PTSD falls within the listing. And here we go. Exposure to actual or threatened death, serious injury, or violence, which you can check off. Subsequent involuntary re-experiencing of the traumatic event, for example, intrusive memories, dreams, or flashbacks. Avoidance of external reminders of the event. Okay, so what are the things that you do to try and avoid that event?
Well, my daughter, I'm the one that bathes her. She's been in the bathtub one time. I tried to do it a couple weeks ago, and it ended up with me vomiting, and it's just not that, it's not a stress that I'll put myself through again anytime soon. So she'll continue to have her bathing done in the sink. So.
Okay. And let me ask you this, that addresses the physical aspect of it. What are you doing to address the recurring nightmares, recurring flashbacks?
A little confused on what you're asking me. Sorry. Are you saying how am I trying to get better, or?
Oh, no. How are you trying to avoid having the recurrence of those nightmares? Are you playing music while you sleep? Are you doing? Yeah.
One of the things that I have these intrusive thoughts related to self-harm and what happened. And one of the things I tend to do is watch YouTube in order to get my mind off of those things. I don't really, since they're short videos, they're easier for me to deal with. Like, I don't really watch TV or anything.
So let's go.
That may not be relevant, and if it isn't, I'm sorry.
No, you're doing fine. You're doing great. There is no yes, no. There is no perfect answer. There is no super wrong answer. You're working through this. Let's go through to the next thing. When you go to sleep, how do you prepare for sleep?
Depending on, I try to be mentally so tired that I can just zonk out. I have pretty severe sleep disturbance. I find that the worries are greater at night, So they have prescribed sleep medication to use as needed, and I use that maybe 50% of the time.
Okay.
And my sleep, a lot of times I'm up all night long, literally until it gets light, and then I'm able to relax and actually go to sleep. So that's kind of that story.
All right, now, everybody that's got mental impairments, they don't follow the prescribed medication perfectly. The cocktail is always changing, and they're always trying things out. What are things that you're doing to try and find the right mixture of medication?
Just reporting that it's a nurse practitioner that does the psychiatric drugs, and I check in with her every 6 weeks or so. That we talk about how it's going, and if there's things that should change, and I just leave it up to her. I don't go in there saying, "Oh, could I try this or try that?" She's the one that makes all the decisions for what to try next. So.
Okay. What are your top 5 most severe impairments, starting with the most severe?
The depression, anxiety, the PTSD, and sorry, did you say just 5 top or 5 mental?
Oh, just top 5 in general.
Okay. And the pain in my back and my hips.
Okay. So talk to me about the physical impairments. What's going on with those?
Well, I'm rather obese. I weigh just shy of 400 pounds. I was up 420 pounds, but I've lost a little weight. But I've had hip and back problems for years. The hip problem goes all the way back to when I was born. I was born with hip dysplasia, and so the socket doesn't fit together correctly. But
Okay. So the weight, when did the weight start to increase? Was it congenital from birth that you were just growing, or was it one of those things that, there was a moment in time where the weight really picked up?
I did have a large weight gain, but I can't for sure say exactly when it was. I went from about 280 pounds to like 350, and then from 350 up to very high 300s. Some of that was around the time that my son died, but there was other periods in there where there was large jumps that I can't recall any specific reason for it or anything like that.
Is there a gastrointestinal issue that you currently have?
Yeah, I have what may be IBS. They're still testing me, but I sometimes have trouble controlling my poo. So.
Let me ask you this. When it comes to just digesting things, higher up the chain, do you have any difficulties there? Do you have any acid reflux? Do you have any issues with?
Yeah.
Okay.
Yeah, I have acid reflux.
Okay. Can you tell me this, with the weight gain, are you doing anything to go ahead and reduce the weight that you have?
Exercise is really difficult, both for the reasons of leaving my daughter or leaving the house, but also physically it's just difficult. But I've really been trying to moderate what I've eaten, and that's what's helped me lose that 30 pounds that I have lost. I trying to control my emotional eating.
Okay. With your therapist, what have they tried to get you to forgive yourself for what happened?
I don't know how to exactly explain it. They do try to get you to, but
Well, tell me about it a little bit. I mean,
Yeah.
give me a little walkthrough. What's going on?
One, I guess, a pertinent fact is actually I have recently changed therapists. My therapist that I had seen there's. Let me explain one thing. So my therapist was the 3 year. I saw him for 3 years. He was a PhD student himself, so he would leave during the summers to go back east to attend classes. And the gentleman I referred to that was my therapist, his boss was the one that did the
Consultative examination. Yeah.
He was the fill-in over the summer for my long-term therapist. But recently, my long-term therapist stopped seeing me because he felt that he couldn't help me. That was about 2 months ago. He suggested that I see someone else, hoping that maybe they could help. And so I'm on to another person at this point in time. We haven't really got to that point in our therapy where I more or less started over from the beginning, and we're just kind of working our way up to the more meaty stuff.
Okay. Let me ask you a series of tough questions. Are you ready for them?
Sure.
Okay. Are you able to drive a car?
I am.
Okay.
I don't drive very far, but I am able to drive. So.
Okay. Let me ask you this. With the older children that are 7 and 9 years old, what has happened to them that triggers your impairments with the child that you lost in the bathtub? Remember, you don't have to answer. You can take a break if you want to at any point.
I'm just trying to figure out. Okay, sorry, could you repeat the question?
With the 7 and 9 year old children, the older ones, what has happened to those children that is similar to, you weren't there, something bad happened. Had you been there, it wouldn't have happened. What are examples that happened with them?
Well, they don't really get to go anywhere. The 7-year-old's she's never been to a friend's house, and the 9-year-old's been to a birthday party once. We worry about them being away from us, and not exactly to the same intensity as a 2-year-old, but to the point where, unfortunately for them, they don't get to do a lot of activities. So.
Now, is the lack of activities due to a fear that you have that they'll get injured?
Yeah, I mean, I've always even before this, I've been very wary of them going to people's houses because of the fear of like firearms or something like that. Because people are not responsible necessarily.
Okay. Would it be an incorrect statement to say that the weight continues to go up or be stabilized at a very high level because you are upset about what happened, and the weight also keeps you from being more active with your children, which you're afraid to take them outside of the bubble, which then creates this little rotation of gain weight, become upset, gain weight, limit the children's exercises? Is that correct?
Yeah, I mean, other than the fact that I have lost that 30 pounds recently.
Which is good, which is very good,
Yeah.
Now, help me out with this. What weight should you actually be based on what the doctors are telling you?
I think I should weigh 172 or something like that.
Okay. And can you tell me this? Have they discussed surgery with you, or is this an eating habit-based issue?
There has been questions on whether I would be willing to have bariatric surgery. Kind of freaks me out. But,
Okay. Now, let me ask you this. Does it freak you out because you would have the weight loss and not recognize yourself? Does it freak you out because you would be away from the children during that period? Does it freak you out because you would not be able to be an adult figure during that time, but rather you would go into being needed to be taken care of yourself?
I would say that the last two reasons would be accurate.
Okay.
For one, just finding the time to do something like that. My significant other works a split shift job, and she's the only one that can do her job, and it would just create a lot of problems for her if she had to take care of me. So at work.
Okay. And let me ask you this. When it comes to the 2-year-old, have you had any almost accidents?
No. She's had 2 incidences in her life where stuff happened, but they weren't related to any sort of negligence. When she was born, she didn't breathe for several minutes, so that was pretty traumatic. And then one night, we thought that she had stopped breathing, but obviously she was okay. So.
Can you explain this to me? When it comes down to, your significant other, can you walk me through this? Are you more concerned with her concern that you might not be able to watch the child appropriately, or are you more concerned with your own difficulties with your history of watching a child appropriately?
Yeah, I think it's an internal struggle. I think that she believes that I can do it. Obviously, she must think that because she trusts me to do it. So yeah, if I understood the question correctly, my concern is internal to myself.
Okay. So, all right. What we've discovered through this conversation is that you are unhappy with yourself. This puts you into this rotating cycle, which is creating unhappiness to the point where you're not willing to go ahead and test out new boundaries. The anxiety and depression build on themselves because they have recurrent memories, flashbacks, nightmares that are telling you that your anxiety and depression are proper and accurate for what you're doing. Your medication obviously isn't getting you through it. So let me ask you this. I know it just like you know it. When did the suicidal ideation start? And it sounds like it's pretty much gone away for the most part. Is that correct?
It started when I was like 10 or 11, and no, I have many, it could be over 100 ideations a day. So.
Okay. Are they getting more suggestive, or are they the same thing over and over again?
One of the medications I'm on has decreased the number it was more in the past. And I would say that are you referring to like the method that I have ideations about, or what exactly?
Yeah, like what is it? A car? Is it a bus? Is it a plane? Is it is it jumping over a bridge? What is it?
My kids are sitting right in front of me, so okay. I'm gonna.
What is the therapist? Yeah, what is the therapist doing to go ahead and reduce that?
They've asked me to talk about what methods are of interest, and I guess that would be about it. I don't know, like what. I guess I'm not sure what gets him out getting you to say it out loud. It took a long time for me to even say it out loud. It took me actually, the first person that I told exactly what it was the idea was actually in a consultative exam. I had kind of mentioned stuff before, but to be totally honest, that was the first time. But since then, I've been able to talk about it more with the therapist.
I have a question. I don't know the answer to it. I'd like you to help me out. When did you start talking to your significant other about the suicidal ideation?
We don't talk about it. So
that's what I thought. That's what I thought. And here's how I knew that. If you had talked about it, you would have been able to say to me certain things about it that were more specific. But you're dodging a lot of things to just be like, here's the point, here's the issue. You're kind of on the outside of it. Like, if we look at like a fruit, like you're not where the seed is with it. You're kind of on the outside of the skin of it. So I would like you before, and I'll give you a quick answer to your email because that's why you're calling in. But I would like you to, if you could go ahead and promise me, speak to your wife, or is it your wife or your significant other?
Yeah, we're engaged. We're not married.
Okay, gotcha. So I would like you to go ahead and talk with her tonight, if you will, specifically about those things that keep popping up in your head. And I would like you to go ahead and begin the process of asking her to forgive you for what happened in regard to those memories that keep popping up and in regard to the ideation that keeps coming back to you, because the most important person in your life that is the gatekeeper to you actually getting any bit of peace that you can is not the children. It's actually your fiance. So now to answer your specific question about the email, bottom line is objective documentation and evidence. You may have not used the proper wording. You may have not used the proper trigger words that say, hey, this is why I have this, etc. What I'd like you to do is I'd like you to look up 12.15. Again, SSA 12.15. SSA 12.15 is going to have the wording that they are specifically looking for that outlines that trauma. I'd then like you to look at specifically 12.04. That has specific words that are going to help you explain your issues to the doctor. I would like you to look at 12.06. That's your anxiety. That gives specific words. And then I'd like you to look at 12.08 because I think there's some personality and impulse control disorders that are pretty darn strong with this as well. And I can pick off some of these. Let's go through them. Distrust and suspiciousness of others. You've got that. Detachment from social relationships. That's why you're not talking to your wife about it. Disregard for and violation of the rights of others. We know why that's an issue. Instability of interpersonal relationships. We know why that's an issue. Excessive emotionality and attention seeking. I haven't talked to you enough to know why or if that's even happening. Number 6, feelings of inadequacy. That's why you haven't brought up the whole detail about what's going on in your head about the ideation problems. Excessive need to be taken care of or taking care of others. These are all things that you fit into very clearly. But I would like you to take that first step, if you'd be so kind, and talk with your significant other, your fiance, because she actually holds the key to you getting some more peace. You'll never have full peace. None of us will. But she is the key to getting a little bit more peace in your life because you do hold very heavily in your heart a desire for her acceptance of you after the fact. And I think it's incredibly important for you to just be open with her about the ideation, if you'd be so kind to do that. But good sir, do you have any questions for me at this point?
question. When you look at the listings and it says extreme limitation of 1 or marked limitation of 2, it's kind of a mystery about how they actually get to these things.
It does seem like that. No action. Yeah, right. I know it does. It does seem like we have definitions for, and marked just means severe. So we have definitions for no evidence, mild evidence, moderate, severe / marked, and extreme. And we have evidence, and we use, basically a system based on your capabilities. We have a definition for them, but we also have a system like, are you able to do this? Not at all. Are you able to do this 1/3 of the time? Are you able to do this 1/3 to 2/3 of the time? Are you able to do this 2/3 to all the time? And these are kind of the systems that we use to help define essentially whether or not somebody is impaired. And what you want to do is, here's part of the problem too. The medical language that they use does not always match up with the Social Security Administration's language as to, that leveling, right? Is it really severe? Is it not? Is it really extreme or is it not? I think the easiest way to look at it is, and I've struggled with ways to make this seem simple to people because it's a lot of stuff that's really tough. If you're not able to do something, like at all, that's an extreme impairment. That's completely limited you to the point where you just can't do anything. If you're not able to do something 0 to 1/3 of the time, now we're talking about more of those severe marked territories of limitations, right? So if you can't sit, or do the kneeling or do the concentrated if you can't do that 0 to 1/3 of the time, and you're leaning more towards that 0 of the 1/3, because every time they go and define this thing, or at least the practice of it seems like it's getting more and more towards you can't do it. The point is, they're trying to say you don't have the capacity, physical ability, mental capability to go ahead and do that thing as much as a regular, average, normal, day-to-day person should. And so what they mean by that is, okay, and that's why there's a backdrop, right? The backdrop of this whole program is, if you can't work, you'll be found disabled. Well, if you can't work, a lot of jobs won't let you go ahead and, let's call it like it is. A lot of these jobs won't allow you to just do some function there 1/3 of the time. They expect you to be able to do it the entire time. And now we break it down. We have very heavy, medium, light, sedentary sitting work. So with sedentary work, we're like, okay, cool. The person has to be able to sit for 6 out of 8. They have to be able to go ahead and stand or walk for 2 out of 8. The point here is this. What they're looking at is your capacity to do work functions. Because if you are, let's be honest here, unable to do certain functions at that job, it makes you not as valuable as an employee. In fact, you might become so, and I mean, this better than anybody. You've been fired from 32 of the past 37 jobs you've had. If you can't do certain things, or you have to get home really quickly, or you keep forgetting something, or you are aggressive towards others, that makes you unable to do certain functions at that job. And if we're looking at the 0 to 1/3 of the time that you're not able to do those functions that you could have been able to do because of your impairments, then we're starting to look at that severe territory. But the extreme is like, you just can't do it. You know what I mean? Extreme is like, you're blind. You can't see. You're not able to do it,
It was I mentioned that in the email. I found it weird that the psychiatrist commented on so many things from the exam when it was stuff that was never even brought up to discuss. It seemed like he just kind of waved his wand around and was like, "Oh yeah, no."
That's a good way of putting it. I really like that. He waved his wand, because that's what it feels like when I read these reports. There are these super detailed reports when the person was in there for 10 minutes. And I'm just like, there's no way this doctor went through all of those things. Ain't no way. There's no way. All of my claims. Now, are you represented currently, or are you just you're doing it yourself?
No, I tried the first 2 steps by myself, but I'm currently in the process. I just found out I was denied about 2 weeks ago.
Okay. Well, you're going to a hearing now,
ago.
so you should pick up an attorney because you need somebody to cross-examine you in the hearing. But the point is this. I think this is really incredibly important for your particular claim. First and foremost, realize that DDS doctor, that CE, consultative examination medical expert, we call him a CEME, that CEME does zillions of these usually for the SSA. And a lot of the stuff that they do tends to be a copy-paste boilerplate for your particular types of impairments. They'll throw in a quick fact pattern, and they'll basically do a diagnostic impression off of their analysis, and then boom, it's out. It's back to the SSA. They get paid. So you need to understand, you need to try and discredit that consultative examination. So when you find an attorney, one of the big things you need to ask them is, especially for your claim, what are the things that you do? And we use a post-CE debriefing form, but what are the things that you do to discredit the consultative examination medical expert that I went in front of? Now, you've also got an uphill battle because you weren't prepared going into that CEME. So I don't know what you said to this guy or girl. So, you got to, and I know you haven't seen the report yet, but now that you're going out into the ALJ level. I've
actually read the report. So
what did it say?
I'd have to see if I can pull it up here. After I was denied initially, I asked for a copy of the file.
Okay, tell me about it.
Sorry, I'm trying to find out my email. Sorry, one second.
Yeah.
Okay, I found it here. Which sections would you like to know what it says?
Oh, okay. Let's start with the diagnostic impression. How many pages is it? If it's about 3 pages, check the last page.
It's 15 pages long.
Okay, cool. All right. So how much time did you spend with this doctor?
About 40 minutes.
That's pretty good. 40 minutes. That's a lot for a usual consultative examination. Is there anything in the report that was talked about that you didn't go over when you were actually in there?
Anything about my activities of daily living, other than he asked me if I cleaned. That was the only thing that cleaned and cared for pets.
Okay. So that's your beginning point. I want you to go ahead and mark that down. That is something that was not discussed that he added unilaterally. Okay, next thing I want to go over, are there any medications specified in the report?
The diagnostic summary is like 3.5 pages long. Let's see.
Well, all right, let's do this because I am super duper tired tonight. I actually was working outside when I got done at around 5. I was actually up at 6 a.m. to go and do some outside work, and then I got to work from the 9 to 5. But the point is this: shoot me an email with it. I'll take a look at it. These are the three things I want you to pull out, though. Number one, I want you to look through and see if the doctor notated if the doctor was given any evidence at all from the DDS rep. So did the doctor receive from the DDS rep any medical documentation? Because the DDS rep is supposed to forward to that medical expert all of the medical records that they have on file for you. That's
Okay.
number one. Number two, I want you to pull out all the things you didn't talk about that ended up in there. Number three, I want you to go ahead and basically go through it and see if there are any inaccuracies, anything that's a little off. Remember, they don't need to be big things, anything that are small, anything that can be used to lessen the weight of that evidence. Okay?
Sorry, I'm making a note. All right. So, did they send evidence, stuff that I didn't say that was added? What was the other thing?
So you're looking for inaccuracies. You're looking for things that were talked about that you didn't talk about with him, and then basically whether they notated on there whether or not the doctor was given any medical evidence from the DDS rep ahead of time.
Okay. Did it strike you as very odd that the person I was seeing, the therapist, also worked for this guy? And how I found this out was the therapist had a public LinkedIn profile, and it said right on there that he worked there. He had worked there since 2012, I think. I was blown away by when I saw that, though. I was like, really? That's where I end up. I mean, of all the people I could have seen, I end up seeing his boss. But.
Well, let's be realistic here. The SSA picks people with high-level degrees as specialists because those specialists hold higher weight than other types of physicians that don't have a specialty. So the boss of him probably has higher accolades in the academia field. That's A. B, let's call let's call like it is. You know, these guys have been around a long time, so the SSA has reached out to them because they've been around a long time. You know, that's the game. That's the game. They get their big shot at the big specialist, which gives them the most evidence and the weight to the evidence. That means if this case has to go to district court, circuit court, Supreme Court, they got a specialist in their pocket. That's not a bad deal to make, and that's why the SSA does it.
Okay. Well, I appreciate your time.
Absolutely, good sir. Have a wonderful, wonderful night, and just shoot me an email if you get a chance to it, and we'll go from there. All right?
Okay. Thank you.
Thank you, good sir.
Like I said, for your time.
Absolutely. Bye-bye. Okay, guys, so we spent a lot of time, going through some of those details there. I am going to go ahead and I'm actually going to, you know what I'm going to do? I'm going to actually wrap up the show, and here's why. I'm super duper tired. I was up at 6. I fell asleep around 2. To be fair, I'm not as young as I used to be able to. I used to be able to go ahead and do all these things and, magically get 2 hours of sleep and continuously do that and come out with great products, blah, blah, blah. I can't do that anymore. I'm too chubby. It's just the bottom line. I'm just too chubby. We said, by the way, thank you all because I'm not crying for now. You've all made me feel better. Depression. Excellent for a couple. We would love to see you go to medical treatment. I think that's incredibly important, but ultimately that is up to you. I've made my threats in the chat session about dog toys. We'll go from there. Now, with that said, who do you guys think should win the $25 donation before we pop off of the live? Remember, there's $25 here that's on the line. Who should get the $25? And I need to write down this person's phone number because, actually, no, I've got his email right here. I'm going to print this out. That way I can always email him later and say, you are the winner, if he is the winner, if you guys choose him. Okay, you might have liked his phone call. You might have hated his phone call. You get to choose. Okay, I see the father. I see the man. I see period. I see the father. May I have it? I see Wolfgang wants it. I think Wolfgang, I did send you one. I think so. The dad you just talked to. Okay, so the dad, the father. Okay, cool. The father may have never one before. Yeah, Wolfgang, I sent you one. I'm pretty sure. If you didn't get one, shoot me an email because I'm pretty sure I sent you one. You asked me for one, and then I helped you out and sent one like 2 or 3 days later. Let's see for a couple. I can't vote. I didn't hear all the calls. Oh, first. Okay, I guess you could say that. The guy you were talking to. Okay, cool. This last call. Yes, the last call. The dad. You never got it. Okay. Shoot me an email with a reminder. I'll try and look into it tomorrow. I might have to wait until the weekend though. But I did send one off to you with the account that you provided. Whoever you think, rest well. Hopefully, blah blah blah. Man with lost child. Okay. That has it. You did a couple. Okay, cool. So, guys, I'm going to go ahead and pop off of here. I think we had an amazingly good show, and I'm glad that everybody was okay in the chat session, and that everybody is using, their kindness to help guide people. I think that's incredible. I'm going to go ahead and reach out to that father right now via email. And bottom line. If you guys have any questions for me, don't be afraid to reach out. We do have some really, really big stuff coming out. Really, really, really big stuff coming out about the whole how to write a bill that can go into becoming a law. And finally, the top 200 intro video is about to be shot, which will have all of the top 200 videos in it. And then it leads into the first video explaining the details of it. So that entire set will finally be done. And I'm really excited because that took 2 years. Also, Space Constitution, I'm just really waiting for them to approve basically the 501c3 allowance, which is to make it a nonprofit. So at this point, that's pretty much what I'm waiting for. So, and there's a little bit of crackling too with the microphone. So I'm going to be doing a little bit of testing to figure out what's going on with that. And, I've used this microphone for thousands of videos, so it might be time to get another one. But either way, guys, I'll catch you a little bit later. Have an absolutely wonderful night. And we'll go from there. Thanks so much. Bye-bye, guys.